All right, I think we should get going. Ready, Dr. T?
Ready.
All right. Welcome, everybody. My name is Cindy Brown. I'm one of the two administrators for this group. Really happy that you've all joined us. I'd also like to introduce Morgan Hart. Morgan is the other administrator, and she is in physician's assistant school. So when there's medical questions, I usually let her refer to the ones that I can't answer. I'd also like to introduce Lahoma Naktrab. She is our wonderful hostess, allowing us to use her Zoom and helping us with the group and, you know, trying to put together different documents and stuff that might be beneficial to you that we can keep stored underneath the group. So, Morgan.
So for the disclaimer, by participating or listening to this content, you agree not to use the information presented here as medical advice in treating any medical condition. This forum does not constitute a physician-patient relationship. The content here is for informational and educational purposes only, and because each person is so unique, please consult your healthcare professional for any medical questions or treatment options. So now to introduce Dr. Trevino. Dr. Trevino is a licensed and board certified doctor in internal medicine. He received his medical degree from the Autonomous University of Guadalajara in 1982. And Dr. Trevino completed his residency at the Albert Einstein College of Medicine in the Bronx, New York. And he has an associate fellowship in integrative medicine from the University of Arizona Medical School in Tucson.
Thank you, Morgan. It's my pleasure to introduce Dr. Miguel Trevino. Dr. Trevino, welcome.
Hi, everybody.
So how long have you been practicing medicine?
Well, for about 30 plus years, I think. I'm
What
getting
got you
old.
You're getting old. Yeah, I can relate to that. What got you interested in treating autonomic dysfunction patients?
You know, basically what I say is that pretty much autonomic dysfunction chose me because I saw one patient, couldn't figure out what was wrong with them, finally figured it out, and then sort of word of mouth got out, and then just people started coming. And then there was just, it was almost like everywhere I went, I'd find somebody that had either EDS or autonomic dysfunction, or even in December when I was riding along in the ambulance because I was pretty sick, and I won't go into it, but the paramedic that was starting my IV and I, on the way to the hospital, you know, she asked me, well, what do you do? And I said, well, I'm an internist, but I mostly work with people with autonomic dysfunction and POTS. And she says, oh my God, I have POTS, and I have not found anybody to treat my POTS. And that's while I'm in the ambulance. So it seems like everywhere I go, there's people that need care, and it's so hard to find that I just kind of now I'm dedicated most of my working day to this.
How many years have you been treating autonomic dysfunction patients?
I think 12 now, 12 or 13.
12? Wow, that's a long time. And approximately how many patients would you say you've seen in that 12 years?
I think it's up to 1,200.
Wow. And that really in the last 5 years, right? Really grew?
I think it just steadily grew.
Steadily.
You know, I wouldn't. What happens is most of my other patients that I used to see on a regular basis can't find spots to see me, so it just gets filled up with autonomic dysfunction.
We can sure understand, you know, we're lucky in Florida that we have you. And I think all of us have a story of not being able to find a doctor to treat us properly and diagnose us properly. So thank you for dedicating your career to helping all of us. It's very appreciative. We're going to go through now the diagnostic process of a new patient that came in to see Dr. Trevino. She was a 58-year-old female, becomes a new patient. She reports ongoing multiple system issues for the past 30 plus years, and she's progressively getting worse. You can see the presenting symptoms that this particular woman came to see with Dr. Trevino. It's a very, very long list, so I won't go through the list, but if you do have any questions on the symptoms, we're more than happy to try to answer those. Dr. Trevino, you look at this list and there must be 20 symptoms, maybe 15 to 20 symptoms. How do you even begin to work with somebody that has that many symptoms?
So I think the main thing is that there are a lot of symptoms. EDS and autonomic dysfunction and mast cell affects people from head to toe. And so I think the main thing is you need time. You need time to try to figure out, every single symptom, where is it coming from? So, even if we take just the first few symptoms, fatigue. A lot of people are tired and they say they're tired all the time, but POTS patients are what they call they're extreme. They have extreme fatigue. They're so fatigued they can't get out of bed. They can't lift their head off the pillow, and that makes a difference. They may not be that way all the time, so you have to figure out if it's just fatigue, regular fatigue, like after you have a flu or a cold, or you're just tired because maybe you're on a medicine or your thyroid is low, or just a mild fatigue, or is it something that's really disabling for you? So you really have to get into every symptom and try to figure out how bad it is, how disabling it is, and where is it coming from. And once you do that, then you can sort of start putting a puzzle together that will help you with a diagnosis and treatment.
So Dr. Trevino, is it pretty common then for you to see new patients that come in with long laundry list of symptoms like this particular patient?
I would say most patients who've had this disorder have had it for a while. They've been to, 10 different doctors over the last few years. Some people haven't. They come in fresh. And they have a list. They have a list, which is very similar to this one. When I see a list like this, to me, it makes perfect sense, but I think for most family practice doctors, it's like their worst nightmare to see a list like this, because it's just way too much. And, in our current medical dysfunctional status of how medicine is practiced in the US, the family practice guy has 7, maybe 15 minutes to go through all this. And that's just way too much for that little amount of time. So I guess the key is time, and we just don't have it, in the way we practice medicine. So it's difficult.
Would that be something that's helpful when you're starting with a new specialist or physician? Tell them explain that you have an extensive history and a very complicated situation, and then you need an extra long visit, because I know if you're going to usually like a Vanderbilt or Mayo, they set you up with an hour, but if you're going to your local neurologist, they're going to set you up with a 15-minute appointment. So would it be appropriate to ask for a longer appointment?
Sure. I mean, the longer the better.
Dr. Trevino, when you're looking at this list of symptoms, are there any particular symptoms that you're looking for in an autonomic dysfunction patient? And if so, why would they be important? What symptoms would be important to any of our participants to make sure and let their doctor know?
Yeah, so when I look at this list, the first thing I want to know is, are you hypermobile, right? What do you score on the Beighton scale? Do you bruise easy, bleed more than normal, scar differently? Does Novocaine and lidocaine not work for you? And then, do you have any of the other, do your joints sublux or pop out? Do you have a lot of muscle cramps and spasms? Do you scar differently? Does it take you forever to heal from things? Have you broken your bones and not really had that big of a trauma? Have you had spontaneous disc ruptures? So those are the first kind of things, because if you're hypermobile, chances are you don't have to be hypermobile to have autonomic dysfunction, but if you're hypermobile, chances are you're going to have autonomic dysfunction, and mast probably, or could have mast cell activation as well. So for the autonomic dysfunction, I think the things that people complain about or that are most disabling are their inability to stand. So they literally can't stand to stand. I think everybody hates the heat, or almost everybody. I mean, not everybody hates the heat, but can't go outside in the heat, can't stand in line in the heat, has stopped going to the parks, the Disney parks and the Busch Gardens and things like that. They probably don't even like to stand in line at the supermarket. So they literally can't stand to stand. That's very important. And then they usually have what's called crushing fatigue and brain fog. Those are the things that I find are very common all the time with an autonomic dysfunction. And then as far as mast cell, I'm looking for, do they have a lot of allergic reactions, rashes that don't make any sense? Have they been to an allergist to be allergy tested, and either they blew up and everything tested positive, or they did all the tests and nothing came out? Do they have are they consistently inconsistent allergic or inflammatory reactions? So sometimes they'll say, sometimes I eat a pineapple and I'll break out and it'll be horrible and I'll feel terrible for a day and I'll have diarrhea, and then a month later I'll eat pineapple again and nothing happens. And so I'm looking for allergic inflammatory reactions that make no sense, that people can't figure out what's causing them, that are consistently inconsistent. Because when you have just plain allergies, usually those are IgE mediated. So when you have an antibody that's mediating your allergies, usually every time you get exposed to whatever it is that you're allergic to, you're going to have a reaction. But with mast cell, it doesn't happen that way. And so it's just, so I'm looking for inconsistencies in people with mast cell. So those are out of the 3 disorders that usually I have to deal with. And then, because you can also have other disorders with this, normal, disorders that can be aggravating it, you want to look at those as well. So, if you're diabetic and so not under control, or if your hormones are off, or you have other disorders, you have to take into account all of that as well.
Thank you. Dr. Trevino, do you treat based on increasing quality of life, or do you focus more on starting the treatment workups based on the potential severity of the underlying condition?
So do I treat based on
Quality of life, or do
quality
you
of
focus more on the severity of the underlying conditions?
Well, those two kind of go hand in hand, right? So,
Yeah.
so it sounds to me like the more severe your issues are, the worse your quality of life is. So, I look at I try to look at where you are on the disability scale. And, if you're well, like Kathy, who's in bed all the time and can't get out of a chair and is a 10 out of 10 disabled, I'm looking to try to get her down even a point or two. If you can get down to 5 out of 10 disabled, that's a huge difference for a person. And so you're looking at both, really. You're looking at both the severity and the amount of disability. And hopefully you can try to get things better in both arenas.
Lahoma is going to post in the chat now the different diagnoses that this particular patient had when she came to see Dr. Trevino. The dates are the dates that she was diagnosed. So it's as you can see, it's a long list. Dr. Trevino, what are the most important things for you to look for when evaluating patients for POTS, mast cell, and EDS? What are you looking for?
So once we get done with the history, and the history will also include other things that happen with people with that are hypermobile or have EDS, and other things that happen when you have autonomic dysfunction and mast cells. So with EDS, I want to make sure that they don't have symptoms of Chiari, sleep apnea, because most people with autonomic dysfunction have sleep disorder, but they can also have sleep apnea. Mitral valve prolapse, make sure they've had an echocardiogram and a cardiology evaluation. Median arcuate ligament syndrome, so if they have pain, nausea, and bloating every time they eat or drink anything and they're starting to lose a lot of weight. And make sure they don't have hernias, prolapses, that could be also interfering with their quality of life. And then as far as with autonomic dysfunction, I want to make sure that they don't have other autoimmune conditions that could be causing like dry eye, dry mouth. I want to know exactly how bad their blood pressure pulse dysregulation is. And also gastroparesis can be a very disabling for a lot of people. So I want to make sure they don't have that. Diarrhea, constipation, bladder issues, and of course the heat and cold issues that happen with autonomic dysfunction. And then with mast cell, of course, I want to kind of try to figure out, are they having anaphylactic reactions very frequently? Are they using EpiPens all the time? And then also, so once I'm done with that part of it, then I would want to go into the treatment, the testing for those disorders. So as far as EDS is concerned, I want to make sure that they don't need like an MRI or of the brain, that they don't need a sleep study. They may need an echocardiogram if mitral valve prolapse has not been looked at. I want to make sure that they don't have symptoms of median arcuate ligament syndrome, hernias, And then as far as, so that's as far as EDS. And then as far as autonomic dysfunction, I want to do a poor man's tilt table. And usually the poor man's tilt table, I'll do it. I'll try to do it without medications if they're not on any medications. But even if they're on medications that could alter the tilt table, I'll do it anyways. I'll lay them down, do a blood pressure and a pulse, and stand them for a few minutes and do a blood pressure and a pulse, because that'll tell me, one, if the medications they're taking are working correctly, or if they need more or less of what they're taking. And it'll just give me a general idea of where they're at, right? So if they're already on beta blockers and let's say Florinef, and we do a poor man's tilt and their pulse goes up to 150, well, then I know that the medicines they're taking are just not doing the job that they need to do. So I'll do a poor man's tilt on almost everybody, whether they're on medications or not. Now, for practical purposes, you should do a poor man's tilt table without medications, because that will give you, if you're trying to establish a diagnosis, that will give you the answer. I want to make sure they don't need other blood tests, tryptase levels. If their tryptase levels are high, do they need other genetic testing, bone marrow testing to rule out mastocytosis or alpha tryptosemia? Autoimmune panels are frequently, order them frequently, just because I find that, large amount of people have these disorders, have other autoimmune conditions like Hashimoto's and Sjogren's and lupus. So you want to make sure you don't do that. As far as, volume depletion, I would say almost everybody that asked the question, when you go to the ER and you get a liter of fluids, do you feel better? That if they say, yeah, oh yeah, I feel better for 2 days after that, that gives me a pretty good idea that they're, volume depleted, or they have low volume, and it's contributing to their POTS. So I'll try to figure out what other tests do they need that are going to help me manage things.
Thank you. Lahoma is now going to post the list of medications that this particular patient was on when she came to see Dr. Trevino. So that'll be in the chat section. Dr. Trevino, when you look at lists of medications, not only this one, but all patients, are there any particular drugs that you look for? And if so, why?
So the problem with drugs is that they all have side effects, right? So, I mean, we can go through this patient's drug list and kind of, look at the things that could be contributing to their symptoms, right? So this person is on a narcotic, which makes your GI dysmotility worse. It can make your constipation worse. You have psychologic effects. Bistolic, which is a selective beta blocker. You have to be careful with beta blockers with mast cell. But out of all of them, the selected ones are the ones that you're probably the safest with if you're also dealing with mast cell and you have to use it. But the blood pressure and the pulse can go too low, and it can also cause fatigue. Sleeping aids can also cause fatigue, so you have to be aware of that. The other drugs like doxepin, which we use as sleep aids, yes, can help you sleep, but then they so if you really have to go through every single medication and try to figure out, is this medication causing more problems, or do you really need it? Like Lasix, for example, in a patient with POTS, probably going to make your POTS worse because it's just making you more dehydrated. Things like non-steroidal anti-inflammatories or COX-2 inhibitors can cause problems with your stomach, so you don't want to be careful with those. Inhalers are probably going to be okay, but the bronchodilators can cause palpitations and make your heart race, and some people just, they make them feel horrible. Xanax and things like that are going to contribute to your fatigue. Anti-nausea medications can contribute to your fatigue and dizziness. This person is also on an SNRI. So as far as antidepressants are concerned, you have the SSRIs, the SNRIs, which increase the amount of norepinephrine that you have. And one of the problems that POTS patients have is they have too much norepinephrine. So some of patients who are on SNRIs feel terrible when they take it because it's just too much norepinephrine. So you have to be cognizant of that and make adjustments accordingly. This person is also on Prolia. Prolia can cause issues with aseptic necrosis, especially in people who are having jaw and tooth procedures done. So you got to be careful with that as well. And then a lot of people take a ton of supplements, and people who have mast cell disorders can have reactions to the binders that keep the pills together. So you got to be careful with that. Sleeping medications like melatonin, probably not harmful, but can make you feel more tired and can make you feel more tired during the day. Aspirin is usually not recommended. Vitamin D is probably okay. Omega-3 fatty acids can make you bleed more. So if EDS patients already have a higher tendency for bleeding, so you got to be careful with those. Probiotics are usually okay and not harmful, but can also cause you to have diarrhea. Multivitamins you got to be careful with as well because of the fillers. And then magnesium can cause diarrhea, and so some people are just taking these things and don't even realize it. So you really have to go through every single med and try to figure out, are these medications causing a problem or not?
Okay. The patients that react to the fillers, is that when you normally would offer some type of a compounded medication because to try to stay away from those fillers?
So yeah, so I think a lot of the fillers are either corn or dairy or wheat based, a lot of them. And a lot of people with these disorders have dairy and wheat intolerances, and corn sometimes too. So so a lot of times getting them compounded with things that aren't, that are, and I don't know exactly what they use, but sometimes that does work. The other thing that you have to be careful with is, because of the gastroparesis, a lot of medications have to be in liquid form. So sometimes the compounder can help us with that as well. So you may be taking all these medications, but if they're just sitting in your stomach and not doing anything, then sometimes you'll have to either crush them and add them to like some applesauce or pudding or something. Or if they have a liquid form of the medication, use it, especially if you're giving a lot of medications through NJs or GJs or gastric or tubes as well.
Okay, we're coming to the conclusion. I have about 5 more questions. If you do have questions, it's okay now to start putting those questions in the chat. So Dr. Trevino, what would you diagnose this patient with and why, based on the information that we've discussed today?
So, I think this patient probably has, the trifecta, which is some sort of hypermobility syndrome. May need to be genetic tested if they have family members who've had aneurysms. Maybe want to get genetic tested anyways. The genetic testing for EDS has gotten a lot cheaper. They test for all 17 types. It's only $250 now, so it's not bad. And then, of course, autonomic dysfunction, and with all that comes with that, and probably as well mast cell activation disorder. But also, she has like recurrent infections, low immunity. So I want to do some autoimmune testing, as well as having like getting IgGs, IgMs, IgEs, just having her immune system as well tested. So I think this person is pretty common to have all three things, plus probably some other things that you're going to have to look into.
Okay. Are there any specific specialist referrals that you would recommend for further workup?
So yeah, I think that's all based on, what's going on. So if you have issues with sleep, where you're waking up a lot during the night, you're having your snore, you stop breathing, you have a lot of nightmares, you may need sleep studies. Both the home sleep studies can give you the answer, and sometimes you'll have to refer to a sleep center as well. The other specialist that you may need is a cardiologist. You may want to make sure that they get tested for their heart, especially if they have Marfan's, or if they have EDS and have family members who've had aneurysms. You would want to make a full, you check all their arteries from head to toe as well sometimes. Very commonly, we end up sending people to GI specialists for all the GI issues, because with all the symptoms that you have with gastroparesis, there's other diagnoses that have to be ruled out as well. So you may have ulcers or GERD or other things that can be contributing to your GI symptoms. Rheumatology is pretty common that we end up sending people for, because so many people either end up having positive ANAs or Sjogren's positive, or other joint issues. I find frequent that patient have fibromyalgia as well, so you may have to, look into that, do the 18-point testing, and then also address that. And you may even have to send them to pain management, or at least try to treat it yourself. So the specialist that I would refer would be just based on what are their symptoms, and is it something that maybe I can start treating, but that I'm going to need further testing, including endoscopies or other tests, or that medications, motility medications, for example, are not that, I would want a GI doctor to look into that first, and for him to either give the okay to prescribe them because they have so many side effects. There's some people who have a really hard time absorbing things, and there's a new medication called Gattex that can help you absorb more water and salt. In patients who have seem to be losing weight, they're not responding. You're about to start them on TPN, for example. You would want to also send them to GI doctor because they need to have a colonoscopy and a gastroscopy before you start that medication. So there's a lot of people you would send it to, but it would just depend on what's going on and what you're trying to treat.
Okay, last question. In addition to medications, are there other things that you would recommend to this patient?
So of course, we always recommend what we call the 4 basics. So we want compression. So what happens when you have POTS is when you sit up or stand up and when you eat, all the blood goes either to your intestines when you eat or goes down into your legs and upper thighs and pelvis. And that causes your blood pressure to initially drop, and then you get a lot of adrenaline production to keep you from passing out. So that usually, when we're doing the tilt table test, one thing I forgot to mention is the way I can tell if you have hyperPOTS is when you're doing the tilt table test, if your blood pressure keeps rising and rising every minute that you check your blood pressure, that means that you're producing a lot of adrenaline, and that would be consistent with hyperPOTS or hyperadrenergic POTS. So, the compression garments, I think we have a list of all the compressions that are commonly used. The 30-40s seem to work the best. They're very hard to get on. We live in Florida, so I know that they're hard to use. They're hard to use on a day-to-day basis. Abdominal binders help. The Spanx or bicycle shorts that are too tight will help. So you want to address that, and then you also want extra water and salt, and there's recommendations for water and salt as well. I think the last time we gave a talk, we looked it up, and it was like one heaping teaspoon of salt is like 4 grams, but all the little the ones that are on the program, you can go by that as well. But they have the NUN tablets, look at liquid IVs, drip drop. And then of course, exercise in a laying down position. So if you have EDS, you're going to need to do physical therapy to keep your joints and your muscles strong. And so you're going to have to engage in that. Most people with EDS, we recommend that they do at least half an hour a day or every other day to keep their muscles and joints strong. The minute you stop exercise, your EDS will get worse, and your autonomic dysfunction and POTS will get worse. So it's something that you have to do all the time. Exercise in a laying down position for your heart, to keep your heart strong as well. And then of course, we recommend the whole foods, organic, gluten-free, dairy-free diet, where you're eating small amounts throughout the day. And the small amounts throughout the day is to help with gastroparesis and the pooling in your intestines. The gluten and dairy free, we recommend everybody at least try it for a month and see if it helps with all your symptoms, the bloating, the nausea, diarrhea. If it doesn't, then you can go back on it. And then the whole foods organic is because since we find that so many people have other autoimmune conditions with this disorder, we just want you to eat as clean as possible. So of course we do the 4 basics, and then, based on what we're looking at, there would be other recommendations as well.
Okay, great. Thank you, Dr. Trevino. Does anybody have any questions? Since we're a small group, you can just unmute yourself and ask.
I did. I had a question.
Angela? Who was that?
My name is Nicole.
Hi, Nicole. Sorry, I can't see everybody because I've got the chat open too. Hi, Nicole. Go ahead and ask your question.
Hi. So I like to, I guess, like stand up for ourselves and get testing done. I'm not diagnosed completely. I guess like my case, they kept telling me like it's really complex and everything like that. It started in December of 2020. I was pregnant, and my heart was racing, my blood pressure was low. I was in the emergency room. They kept telling me because I was pregnant, to drink water and so on and so on. I did. Everything just got worse. I had the baby. Things just never went away. I did see a cardiologist. They did like a Holter monitor. My heart rate was high, but he said everything was fine besides that. And then they kept telling me I was having anxiety because symptoms were changing. And like I would get squeezing. That's not the point. So the point is I went to a neurologist. So she kept telling me that it was anxiety. That's what they kept telling me all the time. And then she did another MRI, and then my symptoms, like I was getting tingling in my hands and my legs, like numbness all the time, and it was constant. And she told me that I have autonomic dysfunction, to look it up and to get on the list for a clinic. And I looked it up, and she's told me that she's not going to do anything.
So what's your question, Nicole?
So is how do we like advocate for ourselves to get testing done to see if there's an underlying condition? Because she told me like she wasn't going to do any other testing for me, just to be put on the waiting list. So my symptoms are changing. I feel like they're progressing. And I just, trying to find out how to help myself while I'm on the waiting list, because the waiting list is extensive. They can't even tell me how long I have to wait. I just don't. Every doctor that I have seen that I try to find myself, like to reach out and see if there's any problems with like my hormones or anything, they're just telling me that it has nothing to do with it. And my diagnosis is a quacky diagnosis.
We've heard that.
I mean, we probably all heard that a million times.
Yeah.
That's what happens every time you go see a doctor that really is not educated in this. And so, it sounds to me like, you have the typical things that are, that almost all POTS patients have. Now, so for you, I would say, I would want to see if you're hypermobile or double jointed, do the Beighton scale, see what you score on that. See if you have all the other symptoms like the easy bruising and bleeding and scarring and not responding to the Novocaine and lidocaine, and go through that thing. And then you're going to need a tilt table, poor man's tilt table. So you need to check your blood pressure and pulse lying down, and then you need to stand up and check it every 2 minutes while you're standing up, and write it down and see if your pulse goes up. If it goes up 30 beats per minute, and you have symptoms while you're standing, you probably also have POTS, and then you need to start treatment. So it's not unusual for people who never had anything to, when they get pregnant, to start having symptoms. Some people who get pregnant actually who had symptoms before, their symptoms go away. So sometimes it helps. I don't really know why. And some people, as soon as they deliver, they get better, and some people don't. And so, I mean, it sounds, who are you going to go see?
I'm on the waiting list for the Mayo Clinic in Jacksonville, and then Vanderbilt. The neurologist just sent the referral, and that's what I'm saying. Like, how do I help myself in the time being? Because she doesn't want to run any more tests. The neurologist told me she's not running any more tests. So in the time that I was, trying to find out what this was, it was just thrown on me. Like, how do I just get testing done to even see until I'm on that waiting, like, until they call me? Because it can be a year waiting list. And I'm just like, how does somebody, sit there and just let a patient that way and not try to help at all, or like point them in any direction to see what's going on?
Yeah, so it sounds like everybody's testing your patients. That's what it sounds like. But definitely do you think you're hypermobile?
Honestly, I thought that that's how it started off because I did have the high heart rate all the time. And it was when I would stand up, I would be very dizzy, like, and then I would feel like I would pass out. Like there was one time, like I held on to my husband because I'm like, something's wrong.
So for you, I mean, it sounds like you have PODS. I would start off with the 4 basics, the compression garments all the way up to your belly button, extra water and salt. Start exercising in a laying down position because so most people, when they try to exercise upright, they don't last very long, and then they get what's called the payback. They just feel exhausted afterwards. And so you would have to start exercising very mildly in a lying down position to try to get up to half an hour a day, but start off with just 5 minutes and then go to 6 minutes and 7 minutes. And then, change your diet a little bit and go to a whole foods, organic, gluten-free, dairy-free diet where you're eating just small amounts throughout the day. And that's how you start. You can always start doing those things because it doesn't take any medications to do that. And then we're accepting new patients as of July. So are you on the list?
No, I don't think so. I just heard of you because I just joined the group and I came across this post and I was like, well, I know that he's in Florida. So, but my symptoms are progressing. Like it was just that now, like there's numbness and then the numbness stopped. And I thought that I was getting better, but actually I don't have sensation anymore, like in certain parts of my body. Like that, like it's just.
So numbness and tingling, where do you have that?
So it was in my both hands and arms and then my legs. And then it stopped and like I didn't feel my heart rate like going fast anymore. And I was like, okay, well, I think I'm getting better. Like whatever it is gone, but my heart rate is still fast. I just don't feel it anymore. And like the sensation, like hot and cold, I don't feel the sensation in my hands anymore.
You have dry eye, dry mouth too.
Dry eye, yeah. But that was something that just came about. And that's what I'm saying. It's happening so fast of what's going on. So
yeah, I mean, it sounds like you may also be having issues with what we call small fiber neuropathy. So 30% of people who have this disorder will have small fiber neuropathy. And we think for a lot of people, it's one of the causes of it. And so you probably need to get tested and then get a skin biopsy to see if that's what you have.
And that would be through the specialist?
The neurologist, there are some where do you live?
I live in Sanford, Florida. So it's by like Lake Mary, Orlando, closer to Orlando.
So there's we can recommend a neurologist who does that.
Okay.
Skin biopsies.
And Dr. Trevino does do TELE-MED. So you'd like to see the patient first if you can, right? If they're
sure, of course.
Right. All right, Angela, you had a question?
Yes. So my daughter's also on this chat, but she's having a bad pain day. So that's why I'm asking the questions. She's 22 and we've been trying to get her diagnosed for the past few years. We know she has fibromyalgia because of her hypermobility and the subluxation of her joints and things like that. We're fairly positive she has EDS, POTS. She has tachycardia. She has the racing heart. Now that we've been listening to this talk, now it sounds like she might have autonomic dysfunction and mast cell. So we've been bouncing from doctor to doctor to doctor. She lives in Virginia, but I live here in Largo, Florida. And she's just seen a geneticist, which it took us 6 months to get to see them. But they said she has a collagen mutation. It just feels like she's getting passed back and forth. She is working with a pain specialist, but at 22, she's starting to get to the high end of the medications where we're getting really worried. We're trying to figure out how do we get a definitive diagnosis. If I can get into Dr. Trevino, I can fly her down here. She can stay with me you know, if we can do things. You just spoke about the small fiber neuropathy. She's having that test done on the 20th, I think. Because she has the numbness in her legs. She can't grasp anything. She can't work anymore because she can't stand for more than a few minutes. So I really need to get a diagnosis so that we can, so we can get her on disability because they keep rejecting us. And so that we can work on getting her pain down, because we can't max her out at these pain medications, but she, like I said, she's 22.
Yeah, and the problem with the pain is that the pain can come from different parts. So if it's a neuropathic pain, then, you know, we don't have that many meds for that. We have Lyrica, gabapentin, and SNRIs. Sometimes small, low dose naltrexone will help people. But so if she has pain from fibromyalgia, that's a neuropathic pain. So that has to.
She's taking Lyrica for that right now. She was
Okay.
on gabapentin, but I believe she's on Lyrica now.
Okay, good. And
but-
then but she can also have muscular pain, musculoskeletal pain. And so that has to be treated with other pain medicines. The problem is, you know, you want to stay away from narcotics because they're addictive and they can make your gastroparesis worse, and then you develop tolerance to them. And so, you know, we try to stay away from narcotics as much as possible. Sometimes we can't, but we try. And
well, it's hard at her age. Some people, they just don't believe her, you know, like her cardiologist won't test her for POTS. She won't do the tilt test. But I'm like, it's so easy to do.
And even when they do it, a lot of times they'll see the spike in the blood pressure and the pulse, and they'll just say, oh, well, you were a little bit tachycardic and hypertensive, but that's okay. You're okay. Just,
yeah, they're like, you're too young to have these things. And
so,
you know, that's what she keeps hearing. And it's like, no, but she really does.
So that's pretty common. She just needs to make an appointment, and then we'll hopefully get her the diagnosis that she needs and start her treatment.
So we actually have an appointment with a geneticist in Jacksonville, my husband and I, because they want to do genetic testing to see if it's coming from either one of us or if her collagen mutation is on its own. Do you think that's beneficial?
Well, it's not going to change your treatment. So,
No.
So it is beneficial in the sense that you want to make sure you don't have vascular EDS, because the follow-up protocol for vascular EDS is different than from all the other EDSs.
Okay.
Most people have what we call hypermobile spectrum disorder. So there's a lot of people who are hypermobile who don't have any illness, but a lot of people do. And so it is a genetically it is a genetic condition that gets passed on. And so probably if she's sick and has POTS and EDS and double jointed and her joints are popping out, probably you or your husband or somebody in one of your families also is.
Well, we know that there are a few family members on my husband's side who have EDS, and the fibromyalgia comes from my side, but she's texting me and saying that they think she has hypermobile and vascular, that she has both EDS.
So if they think that she has vascular, then she definitely needs to be genetic tested. The test for that, I think, is a COL3A1. And so, yes, she needs that because then she'll have to have all her arteries imaged either with ultrasound or MRA or CAT scan and make sure she has no aneurysms anywhere. And then she'll have to be followed up frequently. So it is important that you get genetic tested if they think it's a vascular EDS thing.
And you are taking new patients?
We're taking new patients in July.
In July. Okay. Well, like I said, she lives in Virginia, so I can fly her down. But I guess it would be a good idea for us to make a longer appointment since she's only going to be here for a short period of time.
Well, usually within an hour, we can do everything. So our first patients are an hour long.
Okay.
And take the history, do the tilt table, and figure out what's going on and start a treatment plan in an hour, I think would be okay.
Okay, all right. She's just texting me. I just want to make sure she doesn't have any other questions. I don't think so, but we will be getting in touch with your practice. I do appreciate your time.
Sure.
I'll post in the group the link to his practice to make it easy for everybody.
Oh, thank you so much.
Sure. Anyone else have any questions?
Yeah, I do.
Okay, go ahead, Kelly.
Dr. Trevino, I have a very long, extensive medical history. I have fibromyalgia. I had ulcerative colitis that they removed my whole and large intestine and made a pouch for me out of my small. I have the gastroparesis. I have 4 vascular compressions, was diagnosed with autonomic disorder and POTS. I'll be going up to Cleveland Clinic. Will having any of these vascular compressions help my POTS? I have pelvic congestion syndrome. I have nutcracker syndrome, MALS, and Eagles syndrome.
Yeah, so I mean, the vascular compression, what does that mean?
The veins being restricted, like the one in my neck, the jugular is being constricted by the styloid bone, so I have no blood flow from that point on. Same with the kidney, and the pelvic is the iliac vein. MALS, well, you know what MALS is, so so yeah, I have all that going on top of the autonomic disorder.
Yeah,
And
my understanding, those are all not that easy to fix.
no, they're not.
But if you can fix them and the surgery goes well, they are worth fixing, and it does help.
Okay.
But there are big surgeries, especially the nutcrackers is not an easy surgery.
Right.
So, I mean, I'm not a specialist in any of those things, but we see enough people that have all those things that we have to deal with, and yeah, so I would say go to you said Mayo is your going?
No, I'm not. I think I live in Columbus, so I'm going to go to OSU Neck and Head for the Eagles syndrome. And I haven't decided what I'm going to do about the kidney, because the one doctor I did see said that I'd probably have to have a complete nephrectomy, because they took out my colon and put in mesh, and he's concerned about, the colon being intertwined with the mesh at this point and the scar tissue. My kidney's still good, so I really don't want to lose it until I have to.
Yeah, so in general, because of the EDS, and especially when you deal with meshes, they don't stick, they come apart, there's always problems when you put things in there, and the surgeries themselves for EDS patients are very difficult. Sutures don't take. So in general, you want to try to do the least amount of surgery possible. Having said that, if you need a surgery, you need it.
Right.
So you have to, weigh the benefits and risks and make a decision on your own. But those are hard decisions to make, because a lot of the surgeries just aren't that successful.
Yeah. Also, I wanted to ask, I have a terrible time regulating my body temperature, like from the top of my thighs up. I'm usually always very hot and sweaty, but from my thighs down, I'm freezing, and it doesn't even matter how much I have on. My toes are like ice cubes all the time. Is there a way to help regulate that a little better?
Not that I know of.
Okay.
And that's part of autonomic dysfunction, temperature dysregulation. So
Okay,
it's not
yeah,
uncommon for people to have one part of their body hot, the other one cold, to feel cold when you're hot, to feel hot when you're cold, to have breakout in these sweats and rashes, or everything gets red. All that is part of the autonomic dysfunction, and I just don't have a fix for that.
yeah.
I do have sorry to interrupt,
No, you're-
a suggestion for this, just because it has been like a life changer for me. One of the biggest improvements with me is acupuncture.
Okay.
Specifically, I see a 5-element acupuncturist if you have one in your area. I know there's some trained in Gainesville. There's a school there.
Mhm.
And a lot of these symptoms and a lot of the autonomic, it addresses a lot of autonomic issues. So for me personally, it has really helped with my symptoms that the medications and lifestyle just don't. And I do feel better like right away when I get the treatments. To keep the benefits, I need to keep seeing my acupuncturist regularly. But some of the things it can, fix right away. But I just wanted to kind of throw that in there because I know some of these things, there's really nothing that helps. And
Right.
I have that freezing issue too.
I'm going to be going to, I guess Cleveland Clinic has an autonomic disorder clinic up there. So I'm going to be going up there to talk with them because obviously nobody wants to do surgery on me until I get my POTS under control. So I was taking salt tablets, but with the gastroparesis, all they did was sit in my stomach and make me very nauseous. So stop taking those.
Yeah, you probably need to be on liquid or under the tongue or some other form of.
Okay, all right. So do they make like sodium tablets like that?
Yeah, there's a lot of ways you can get extra salt in there with.
Okay. All right, thank you.
Thanks, Kelly. Megan, Jamie, you're next.
Hi, thank you for doing this. I really appreciate it. So I'm having a hard time with getting further diagnosed. I've actually been able to access like a tilt table and a high level of testing, but I don't fit well into any of the criteria. And doing POTS protocol or like the high salt, that actually has been really negative in my body. Like I'll get a short-term gain in blood pressure, but then I'll have a lot more pressure in my head, like in my skull, and it will take a longer time for that to dissipate than the gain in the blood pressure was worth. I also had a low amount of dysautonomia my whole life that was not incapacitating, but it was problematic when I would race in the winter. I'd get hypothermic or frostbite real easy, or in the summer with heat illnesses and things like that. And I had a significant head neck injury, as well as a lot of random things. Like I had an abscess between my brain and my eye that ruptured that I thought was a mild stress headache from finals, but it was instead, I actually went completely blind in that eye for a short period of time from it. And it was just one of those weird things that my body did again. But I had COVID last year, and all of this has gotten a lot worse and more confusing because they'll have differences left, right, but some of that's from the neck injury. I have very unstable blood pressure, but it's low as well as sometimes high. So medicating it is somewhat tricky. And I'm just getting bounced around with providers and not accessing appropriate care. They're like, oh, but POTS isn't working for you. It must be in your head. And it's like, did you look at my history? Like, I'm pretty good at overcoming stuff. I just need the support and understanding so that I can do that in my body and live the best quality of life that I can with it. But I haven't been able to access appropriate support or care except for do the POTS stuff that does not help me. So don't know what to do. But
Yeah, so you know, the problem is that sometimes it is very difficult to regulate the autonomic issues that people have. So some people, you know, in the autonomic blood pressure pulse spectrum, you can have low pulse and low blood pressure, all the way up to high pulse and very high blood pressure. And that can happen within sometimes minutes. And so sometimes it's just very difficult to try to find a happy medium where, you know, if your blood pressure is dropping, you're on the right stimulants that will keep your blood pressure up, or also on the right medications. Most of the time, when your blood pressure and pulse are really high, it's because you have too much adrenaline. So you have to be on the right medications that kind of counteract the adrenaline, like alpha agonists, like clonidine. So sometimes it just takes a little bit of patience and tweaking, and just trial and error until you can find a happy medium. And most of the time you can get to a happy medium where your blood pressure is not dropping anymore so much, and where your pulse isn't way high and your blood pressure isn't high as well. So that takes some time. You know, people like who have this problem like you know, sometimes they'll have to see them once a month for 6 or 8 months until we get things regulated. So I think that's not uncommon. What you're telling me is that a lot of people look at you and go, oh, this is way too complicated for me. And it's just going to take you finding the right person. You know, I'll be glad to see you and see what we can do for you after July. Where do you live?
In New York.
Oh, wow. Well, we could do a virtual.
Appreciate that. Thank you.
See what happens. But I don't think, I think, you know, I think
There's opportunity for better
I
stuff.
think, yeah, there is, you know, there is opportunity for you to be less disabled, for sure.
Appreciate that.
There's quite a few of us on today that are patients of Dr. Trevino's, and I know I and all of them will probably agree that, you know, once he got us into a protocol, I mean, I was bedridden, so, you know, I have life again. So it does take a long time, though. I think it took a year for me to really get on the right meds, the right specialists, and all of that. So Lahoma, I think you've got a couple other people that have questions.
Tracy. Hey there. My daughter is a patient of Dr. Trevino's. Thank you for doing this today, Dr. Trevino. And hey, Cindy.
Hi.
She is going to have major liver surgery. It's a done deal. She's going to have to do it. She has a 10 centimeter mass in her liver. She's having a biopsy next week and then going to a hepatologist to see what the mass is once they get the biopsy results. But once they have to do her liver surgery, whatever it is, she has really bad hypermobile EDS. What exactly do we need to tell the surgeon and the anesthesiology team about it? And what can we expect for healing? Because she's hard to heal.
Yeah, so all EDS patients, the surgeon needs to know that they have to be very gentle with all their tissues, that they will bleed more than normal during the surgery. They'll scar differently. It'll take 3 times longer to heal from whatever it is that they're having done. So, you know, we have a little, ask Tanya to give you, we have a little kind of handout with all the things that you have to look for when you're doing the surgery, and the, you know, post-op care as well, with, you know, extra fluids during and after the procedures. Sometimes, you know, if she also has mast cell issues, may have to medicate for that as well, to help her with her recovery. So there's a bunch of things that we can give you those handouts. Just if she's already a patient, just ask Tanya on Monday to send them to.
Okay,
But in
Tanya's.
general, that's it. I mean, basically, they need to be very gentle with her tissues, and they have to expect for her to when, for example, with suturing, you want to use non-absorbable sutures whenever you can, because if it takes longer to heal from something, the absorbable ones will sometimes get absorbed and it hasn't healed right. So then the wounds or the tissue will break open again. So just things like that that the surgeon needs to know about.
Okay, you have her on IV fluids now. She only does it once a week. She does 2 liters once a week. Would it help during that period and leading up to the period to go ahead and bump it up to twice a week with the 2 liters as you have it written?
Yeah, that could help.
Okay,
It
awesome.
could help her get through it, and she could also need some after surgery as well.
Okay, perfect. And I'll be talking to Tanya on Monday. She's already reached out to me. So thank you very much for answering the questions about recovery.
Thank you, Dr. T, for answering all of our questions and for doing these special things. And thank you, Morgan and Cindy, for putting it all together. I know it's a lot of work and we really, really appreciate it.
Well, thank you guys.
Our pleasure.
We do this because Dr. T has the biggest heart in the world and he wants to help every patient, and he recognizes that there are so many patients across the United States that can't find care. And so, if we can do these sessions once a month and provide answers and help people, then, that's
just to get people started in the right path, it would be a great help for a lot of people. So,
yeah. Anybody else have any questions?
As an anesthesia provider myself, the hydrations, especially the day before, the extra hydration when she's going to be MPO would be really important. But the most important thing is not only having her surgical team involved in the care early on, the anesthesia team. So request a meeting with the anesthesia, and the preparation prior to surgery is what's key. You don't want to show up the morning of and then find out she has all these disorders and them never having heard of them and, rolling their eyes at you. It's a major surgery, it sounds like. So I would assume that there's going to be lots of preparation, but just make sure that the surgeon requests that the anesthesia is brought in early into the discussion, because sometimes they forget about us. So that's my little anesthesia additive there.
Okay, thank you. No, that was super insightful.
Okay. And I think I've shared, and I'll be happy to share some key information just in general for anesthesia with all of us. I'll try to add that to the files eventually. And I'm going to, everything I posted here will be posted on our Facebook group, plus maybe some more information that Dr. Trevino added. We'll get the okay with him first to make sure it's all correct. And then this video will also be up. Give me about a week to get that up. Cindy, Morgan, Dr. Trevino, anything else before we close out here?
No, I don't think so. Dr. Trevino, thank you so much for taking an hour and a half of your time on a Saturday to help us. And if you guys have any ideas of topics that you would like to hear from Dr. Trevino, message me. We'll be doing this about once a month. All right. Well, thank you everybody for coming.
All right.
Thank you.
I posted the disclaimer. By participating and listening to this content, you agree not to use the information presented here as medical advice in treating any medical condition. This forum does not constitute physician-patient. The content here is for informational and educational purposes only. And because each person is so unique, please consult your healthcare professional for any medical questions and treatment options. Cover our bases there.
Yep. All right. Thank you, everybody. Have a
All
nice
right,
Saturday.
Thanks for attending.
Yeah. Happy Mother's Day to the mothers out there.
Thank you, everybody. Thank you, Dr.
Bye.
Trevino.
Bye.
Thank you
Bye-bye.
very much.
Everyone take good care.
Bye.